Hey guys, welcome. Shh, the baby's sleeping. Hi, my name is Erin, and I am a health coach and a mom to a 4-year-old and a veterinarian. And I wanted to come on here because I wanted to we'll see how this goes, but I wanted to do a little love letter to veterinary technicians. I have been a veterinarian now for 11 years. I graduated in 2008 from St. George's University in Grenada. I did my clinical rotations at Kansas State University. I worked in corporate veterinary medicine for a couple of years before I got really burnt out and was working really long shifts. Not taking care of myself very well because I was working very long shifts, staying until 10 o'clock at night to finish medical records. And the reason why I became a coach is because I needed a way to be consistent at my workouts and a meal plan that I could follow. So because I was like, I don't know if you know, but in our profession, we pretty much work through lunch. Veterinarians especially rarely get lunch, and it's hard to drink water because we're like so busy. That we usually eat one meal a day, or we binge eat at the end of the day after it's a busy shift. So I started coaching, and it's almost been 9 years. It'll be 9 years on October 25th when I started coaching part-time and being a veterinarian, because it was a way for me to be consistent at working out, take care of myself, drink a shake instead of stopping for fast food on the way to my long shifts, because I was working. Then after the corporate veterinary medicine, I started working in emergency hospital. So I've been working emergency medicine for the last few years and overnight shifts until he came along and all the things. So but many of you might not know that you might remember, prior to veterinary school, I was an RVT, RVT is a Registered Veterinary Technician, and I went to school for that as well, and I got my this is going to date me, but I got my RVT license in 1997. So I did it for just about, I was in veterinary school for part of this time, so I guess almost 10 to 11 years, but I was in veterinary school during that time, and then I would just go to veterinary school, I would finish my finals, I would fly back home, I'd work at the emergency clinic and make as much money as possible on my breaks, and then fly back to school and work and then go back to veterinary school. So that is the life. And I don't know, sometimes I wouldn't change my life, because if I would have changed anything about it, I wouldn't have got to live in the Caribbean, I wouldn't have been a veterinarian, I wouldn't have probably, if I changed anything, I wouldn't have this guy. I would never regret anything in my life. But sometimes I do think I was pretty happy as a veterinary technician because I got a paycheck, I was really appreciated, we had veterinary technician week, even back then, and I worked in the Bay Area, so I got paid pretty well. Relatively speaking, not like a nurse, but anyways, so he's sleeping. I hope this is okay that I'm doing my love letter while he's sleeping. But anyways, I just wanted to say appreciation for all the veterinary technicians out there that are amazing, and we appreciate everything that you do. You're gonna make me cry, actually. All the long hours, all the poop, all the vomit, all the clients that you have to deal with, all the everything. So if you don't know what a veterinary technician is, so I thought I would come on here and educate what is a veterinary technician, because maybe you probably know what a veterinarian is. That's a doctor for animals, right? You might even know what a groomer is, or I don't know, but do you know what a veterinary technician is? So let's do some education here. So a veterinarian too, because we do a lot of things more than just specialized human medicine. General practitioner means we do a lot of things, but veterinary technicians are okay, the list is going to be exhausted. A veterinary technician is a nurse, but they're also an ICU nurse. They're also at the bedside of our patients. They're putting catheters in, drawing blood, so they're phlebotomists, amazingly skilled phlebotomists at that. They're surgical technicians, surgical assistants, I mean. So basically an OR tech. Hello, we're just talking about veterinary technicians. It is Veterinary Technician Week, by the way, and it is from Monday, October 14th through the end, October 20th. They are client educators, customer service sometimes. Sometimes they're even a receptionist when we're super busy. They are client dietitians. We talk about diet with our owners, about pet diet, dietitian, nutritionists. They are OR techs, anesthesiologists. Okay, so in human medicine, all of these things are separate jobs. Veterinary technicians are x-ray technicians, ultrasound technicians, pharmacists, pharmacy assistants, and pharmacists. Well, maybe not pharmacists, but pharmacy assistants. And I do speak some Spanish, by the way. They're dental hygienists. An RVT especially can do dental extractions and suture existing, like they can suture skin wounds, dental extractions, skin wounds, induce anesthesia, and place splints and bandages. Dental hygienists, they're the same as they do medical assisting. They check in the clients into the rooms. They take a good history for us. They take the vitals. I'm sure there's a billion things that I'm missing that veterinary technicians do, but like just imagine all of those jobs in human medicine, veterinary technicians do. They're one person. I mean, it's spectacular. I just want to come on here and kind of create awareness while my son is sleeping to what veterinary technicians do and how much we appreciate them. And I have a special place in my heart for veterinary technicians, since I did go to veterinary technician school, and I was an RVT for, like I said, almost 10 years, a little over 10 years prior to veterinary school. So it was like my first life, my first love, and I really sometimes miss just being able to like do my job and go home. But anyways, I can't even tell you how much I appreciate the help, the support, the hard work, and the dedication that goes in to taking care of animals. And the clients that just don't really see, like they don't see the whole picture. They just see like a little bit of what we do, but they don't see behind the scenes of like lifting 100-pound dogs and taking the gurney out to the car and lifting your pet that's got into a toxin out of the car and bringing them in and triaging them. Their ICU triage nurse, and then setting an IV catheter and getting the veterinarian, and sometimes there's life-threatening situations where they have to be fast and think on their feet, and I just appreciate them all. So I don't know if this was helpful, but I just wanted to, this is my love letter, and I hope it was helpful.